Also on PEI, overwhelmed emergency rooms are struggling to deal with the fallout from Fiona, and my next guest says the impact will be felt for weeks to come. Dr. Trevor Jain is a disaster medicine physician, and he works in the ER at Queen Elizabeth Hospital in Charlottetown. Dr. Jain, thank you for taking the time today.
Great to be here. Thanks for having me, Andrew.
So can you describe for us the current situation in PEI's emergency rooms?
Yeah, I would say 16 years that I've been here. I mean, I don't speak for the health authority, but as a frontline worker, it was the busiest shift that we ever had yesterday. I mean, almost every case was a CTAS-2. That is a high acuity cases that we had. We had extra nursing staff that were kind enough to come from other parts of the hospital to give us a hand. But this wasn't unexpected. I mean, this is a normal surge in a natural disaster. But unfortunately, when you're already operating at 100% capacity, having a natural disaster on top of that makes things challenging.
And so what kind of injuries or what kind of cases were you treating that were common fallout from the storm?
Yeah, so when you look at hurricanes, there's 4 phases of injuries that we see in the population. We see the pre-landfall phase, the landfall phase, and the post-impact and recovery phase. And yesterday, we were seeing a lot of injuries from cleanups, falls from heights, lacerations from chainsaws and blasts being cleaned up, those patients that couldn't access care during the storm that have chronic illnesses, or their primary care providers that had their offices damaged or flooded and that type of thing, that they weren't able to access care. So, we're a small province with 4 emergency departments. 2 of our emergency departments are regularly closed due to staffing issues. So it was a lot of pressure yesterday, both at our hospital and the good folks at Prince County Hospital Emergency Department on the west side of the island. And
so you had to resort to some hallway medicine, right? Were you able to keep up?
Yeah, we kept up thanks to, Maritimers were a team of teams, and Prince Edward Island's a team of teams, and we know each other and we try to look after each other. So, we kept up, but it was difficult. We had offload delays. We were practicing some hallway medicine, but it is a disaster, and we were doing the best we can with what we can. Look, Canada's lucky. We have this Center of Excellence for Emergency Preparedness, which I'm proud to be a member of, a network of nurses and doctors across the nation that have a lot of knowledge with these things that can help mitigate and help in these circumstances.
So as an islander yourself trying to weather this storm, what has it been like trying to provide health care throughout the hurricane?
Well, it was a bit frustrating. We had no CAT scan in the province for about a day and a half, and we, to our neighbors to the south in the U.S., a Category 3, Category 4. I know ours were Category 2 is not unheard of, and they're able to mitigate those things. And those are things that the Center of Excellence for Emergency Preparedness physicians and nurses can help you with in planning to ensure that those things don't happen in the future. So sometimes you had to resort to old school medicine to look after the patients, and I'm blessed to work with amazing colleagues in my emergency department, nurses, physicians, cleaners, everybody.
What have you heard from the community, and what advice do you have to those trying to take care of their mental health? Because we've been focusing a lot on the physical health, but what about the impact on people's mental health when they lose everything?
Yeah, that's a great question, Andrew, and that's the 4th patient population that we see, the 4th wave that we see are those patients with chronic illness and mental health issues. People that already have mental health issues get exacerbated, and some people develop new mental health issues when they've lost everything, when they lost their livelihood and when they lost their home. So this is what I would say. And, practice some gratitude daily. Reach out and ask for help. We have a large number of municipalities on the island, and I really encourage the use of community emergency response teams. These are volunteers in each municipality that can go out and reach out to these vulnerable populations in their community. Disaster recovery starts at the local level. Every disaster is a local disaster.
And finally, I just want to ask you about the temperature, because, it has been quite warm from what I've been understanding. But now the forecast is that, it's going to start to get cool in the evenings, single digits. There are a lot of Prince Edward Islanders, the mass majority, 75%, still don't have power. Are you concerned about that?
Yeah, I'm very concerned, and that's why I encourage, all municipalities to stand up community emergency response teams to check in on the elderly, people that may not be fully able to look after themselves. Look, any temperature under 12 degrees Celsius, you can develop hypothermia. And, it's concerning that on Thursday, it's predicted to be in single digits degrees. So I'm hopeful communities know their neighbors, that we can develop some sort of response to check in, do wellness checks, make sure everybody's fed, watered, looked after, and has a heat source if needed.
Dr. Jain, appreciate you taking the time very much. Thank you.
Thanks for having me, Andrew.
Dr. Trevor Jain is a disaster medicine physician. He works in the ER at Queen Elizabeth Hospital in Charlottetown.